So back to me to talk about sex life. Why talk about sex? Sexuality is part of who we are and can be affected by prostate cancer. Sexuality is more than having penetrative sex. It's about having a holistic approach and looking at the psychological as well as the physical well-being. So in looking at the research, about 80% of patients from Macmillan found that they wanted to receive more information about how cancer treatments can affect sexual function. 75% said that patients felt that they wouldn't be able to discuss that in the first instance, and hence why we're here today and having this conversation to try and allude to some of those things. So what do patients want? More information and health professionals to initiate that discussion. And that's because we found it alleviates anxiety, increases confidence, as well as alleviates fear. So Prostate Cancer UK have a helpline, and they found that patients and partners were calling that to talk about sex and the body image changes. They found that patients wanted to know more about pre and post treatment and how it had an effect on their sexual function. Additionally, patients were calling because they were worried that there was a fear of causing harm to their partner. And sometimes the ladies as well were saying that, as we know with that cancer diagnosis, you wrap patients in a bubble, and so didn't want to feel that they were too needy and putting on to the partner and that pressure. So there was a fear of the sexual activity as well affecting the prostate cancer itself, and that could then cause prostate cancer to reoccur. And so on this note, some men who are on hormones were worried that because we're stopping the male hormone testosterone, by having sex this could increase their prostate cancer. This is actually a myth and isn't the case at all. It's not going to cause any harm, and so not true. Other conditions can also have an effect on sexual life and sexuality, such as chronic illnesses, such as arthritis with causing pain and a change in mobility, and therefore it's that limited movement. Cancer itself, in terms of that psychological worry, as well as the treatment effects. So all of these together combined can cause pain, with the changes in medications and the long-term conditions can have an impact. So how erections work. An erection begins in the brain. The sexual stimuli send signals from the brain via the spinal cord to the nerves surrounding the prostate. This in turn releases the nitrous oxide, which causes blood vessels to relax so that the blood can flow freely into the penis. And then once it's in the penis, the high pressure traps the blood within the both corpora cavernosa. How does erectile dysfunction affect men? We've covered some of those already, but it can have an effect on self-esteem, that changes in body image, and some patients say with certain treatments it's a bit like being in a male menopause, that identity changes, the fear of rejection, and so it can have a long-term effect, an ongoing effect with relationship changes. When there is no erection, there's no affection. We know this isn't true because lots of men have erection problems, as we said, can stop that initiating and wanting that affection. And so this research study has highlighted other areas which can develop, such as causing anxiety and anger and bereavement. So hopefully today, in discussing things, this will help eliminate some of these. So how do we talk about sex? It's having that permission given. So nurses, us as clinical nurse specialists, are key to playing that role. It's about normalising about sex and making it more of a routine question. It's trying to make sure we eliminate that anxiety, so using that language of masturbation and sexuality and offering that reassurance. And as I said before, it's having that expectations of the knowledge to dispel those myths. So psychological impact, we've said we obviously want to confront those misconceptions, and obviously it's looking at what's normal. We're all different, there is not necessarily a normal, so it's confronting those sexual attitudes and considering that sometimes we're on a roller coaster and you can have a change in anxiety and low mood, and it's about redefining that meaning of sex. So I often say and refer back to when I was a nurse specialist at Kettering Hospital, where I set up a prostate cancer support group, We held that in a pub because I thought that was a useful place to hold a meeting with prostate cancer patients. And we would meet each month, but a couple of times a year the men felt that they wanted to have a discussion on their own rather than with their partners. So the ladies were moved to a separate room. But what I found was that actually both rooms were discussing the same things about sex and sexuality. So to try and help overcome some of those barriers, we actually brought the rooms together, and it made such a difference. So I think it's that communication with each other is really important. Also on the communication aspects, there's the Cancer Wellbeing Centre at the back of the hospital at the Robert Horrell, who offer one-to-one supports, as well as other workshops looking at anxiety and fatigue and building confidence. Chemistry is not merely a chemical. However, in today's Viagra culture, men and women hope for a simple solution. Erections and orgasm are just ingredients in sex and not the whole recipe. Affection, communication, patience and creativity can't be bottled up. So in looking at the programme of care, it's about having that education, and that's what we've said is the most important part, and that's why I'm really pleased that you're watching this video today, and hopefully that will open up those discussions. As we've said, it's about patient ownership, and obviously some do find it really difficult to just have that discussion and seek help. But it's also taking that time to focus on where you are now and looking at yourself. And Hannah's going to talk a bit later about mindfulness, which is really important. So now I'm going to cover the physical aspects, and this can be in many ways very beneficial alongside the psychological. So some of the things that we can do are looking at penile rehabilitation, which Charlotte's already covered with the pelvic floor exercises. There's also medical interventions such as tablets, injections and pellets, which I'll cover in a moment, along with physical aids such as pumps, rings and prosthesis. So in terms of medication, the first line we would often suggest is a Pde5 inhibitor. We often all know those ones as the little blue tablet that everyone knows about, the Viagra. This was first marketed in 1998, and it had a huge boost to raising public awareness. That's really important. There's also another tablet called Cialis, and I often say I prefer this one, so if you have a conversation with me, I would often talk about this drug because it's known to last longer. So it doesn't mean that you have an erection for a longer period of time, because otherwise the partners often feel they have a headache and worry, but what it means is that you can have multiple uses. So it's often known as a weekend drug. Whereas the Viagra, you take the tablet and it's kind of that, oh, this afternoon's the time, or this evening, and someone's knocking at the door, or the doorbell rings, the phone rings, and it takes that spontaneity away. I would also say with the tablets that sometimes we start at a low dose, and that's not always effective, and not to be too disheartened. Sometimes we need to increase that dose, and sometimes one works better than another. The companies would also suggest about not having a big hearty meal, so in that romance part that we were talking about earlier, not to have a big hearty meal with a big pie, because it takes longer to metabolise that medication as well. If these are not working, as I say, you can see the GP to get these prescribed in the first instance, but if these are not working, the next point would be a referral to the Erectile Dysfunction clinic, or the ED clinic. So again, discussing with the GP or letting the CNS team know. And in this clinic we would discuss and assess you and go through the other treatment options, and these involve the injections and the Muse therapy, as well as the vacuum pumps, which Darren's going to talk a bit more about shortly. Sometimes the vacuum pumps as well as the tablets can work very well in conjunction together, so we sometimes suggest about a combined approach to help alleviate those erection problems. So we also need to think outside as well as in the box, so sometimes thinking of other things that are useful, such as sexual aids, as vibrators and lubrication, as well as thinking slightly differently, such as the use of scarves and different textures. But also it's about thinking of, as we said before, that psychological aspect and thinking of yourselves and having that time and moments. So thinking of your diet and taking a walk and therefore it's having that ownership and the control back yourselves really helps. So there's lots of useful resources and signposting we can refer to, but any questions, please feel free to contact the CNS team. I'll now hand over to Darren to do his webinar about medical devices and incontinence aids. Thank you.